We have a beautiful 63-year-old patient today with stage 2 getting to stage 3 lipedema. So you can see even after a minor bump, she has that little bruise. That's typical for lipedema patients. Any little bump, they don't even remember sometimes. They get easy bruising, extreme heaviness in the leg, swelling, and tenderness. Even when I pinch them a little bit, you can try that at home. If you pinch your normal patient pinches their cuff, usually it's not painful. But here, even slight pressure causes pains. And also typical appearance of the legs, she has that cuffing around her ankles right here. Poor ankle definition. They covered with a little bit of fat deposits here. In typical appearance of those little fat pads around the knees, we're gonna address those. We're working on the lower legs today, so I'm gonna mark those. That fat around the knee tends to be more granular. You have to work a little harder to extract it. We can do it. And then I just mark kind of compartment of the leg. There's a tibial plateau here. We're gonna work on that. She also has some varicose veins, also very typical for lipedema patients to have some varicosities. The conditions frequently coexist, but also I suspect there's a compression of the venous system with the excessive fat deposits. You can see here, you cannot see her cuff muscles from the back very well. We're gonna work on removing those fat deposits. Patients will also have fat pads around the knee. That's our second stage. We're gonna work on her thighs and we'll work around the knee as well. But frequently they'll have deposits right behind the knee. I'm starting by making 2 little tiny pokes using tiny little needle. If it's a 33.5 gauge needle, it's a small needle. Now we're making a little poke in the skin, that's it. Trying a little poke, the patient does not feel. That allows us to start infiltration of that Tumescent solution. Numbs up the patient using lidocaine and there's also epinephrine. So we start infiltration of the Tumescent solution right here. Usually patients describe to me as a little pinch, some burning, not bad usually. Our patient is doing very well. How are you doing there? Not bad at all, right? So I want to show you something. So this leg is full of Tumescent solution. It's tight. It helps to minimize the amount of blood loss during the procedure. Also, more importantly, it numbs the patient up, so she doesn't feel much of a pain during the fat extraction. You can see, even without us doing anything, you can see a little fat particle that bulges out right here. So it just shows you how much pressure is within that subcutaneous fat. Probably that's what causes so much discomfort and pain. And those fat cells are not very pliable, they hard, they kind of inflamed a little bit, and you can see that it bulges through already. So I'm gonna start using my curved cannula. So it allows me to do more around the knee and through the just one opening, because I can move it around. So we start in the fat extraction, and you can see the fat that comes out in the cannula. You can see how whitish and pale it is, and there's absolutely no blood. Patient being awake for the procedure, that she can help us to turn so we can work all around 360 liposuction. She can move her foot, and this way I can get around her feet for better liposuction, better definition.
What do you feel? They're working on me now, and I just feel great. It's like a lower leg massage, not deep tissue or anything. It's pain-free. It feels great. It's fabulous. I'm very excited. So I thought the awake procedure would be a little bit painful. I thought that I was going to feel like needle pricks or something, a little bit with an intense pressure. I feel absolutely nothing. I feel like there are 2 people massaging my legs from both sides, and I'm feeling absolutely zero pain.
So the front and the back of the legs are done. The patient is not 18 anymore, so we do have a little bit of a skin looseness there. However, again, from doing a lot of those, I found out that below the knee, the skin usually responds very well. The skin shrinks quite well. So she will wear a compression garment. Usually I recommend around 6 weeks, and that will help with the skin shrinkage quite a bit. You can see the outline of her muscles. Overall, just significantly smaller lower leg. We helped her with the symptoms of lipedema. Again, this is not a cure for lipedema. This is awake lymphatic sparing Tumescent liposuction, but it helps to manage the symptoms quite a bit. They usually have less bruising, less swelling, they feel much lighter, the patient's able to ambulate much better, and their looks look also much better.